This is Chapter 18 of the Maternal Newborn ATI, Baby-Friendly Care. Bonding and integration of a newborn into the family structure should start during pregnancy and continue into the fourth stage of labor and throughout hospitalization. Assessment of bonding and integration of a newborn into the family structure requires that a nurse understand the normal postpartum psychological changes the client undergoes and the attainment of the maternal role and the recognition of deviations. Baby-friendly care can be promoted by delaying nursing procedures during the first hour after birth and through the first attempt of the client to breastfeed to allow for immediate parent-newborn contact. A client's emotional and physical condition, unwanted pregnancy, adolescent pregnancy, history of depression, difficult pregnancy and birth, and the newborn's physical condition, prematurity, congenital anomalies, after birth can affect the family's bonding process. Culture, age, and socioeconomic status are factors that can influence the bonding process. Bonding can be delayed secondary to maternal or neonatal factors. Psychosocial and maternal adaptation. Psychosocial adaptation and maternal adjustment begin during pregnancy as the client goes through commitment, attachment, and preparation for the birth of the newborn. During the first 2 to 6 weeks after birth, the client goes through a period of acquaintance with the newborn as well as the physical restoration. During this time, the client also focuses on completely caring for the newborn. Finally, the act of achieving maternal identity is accomplished around 4 months following birth. These stages can overlap and are variable based on maternal, infant, and the environmental factors. Phases of maternal role attainment. Dependent, taking in phase. It's the first 24 to 48 hours. Focus on meeting personal needs, rely on others for assistance, and excited and talkative. Need to review birth experience with others. Dependent and dependent is taking hold phase. Begins on day 2 or 3. Lasts 10 days to several weeks. Focus on baby care and improving caregiving competency. Want to take charge but need acceptance from others. Want to learn and practice. Dealing with physical and emotional discomforts can experience baby blues. Interdependent, letting go phase. Focus on family as a unit. Resumption of role, intimate partner and individual. Assessment. Nursing assessments include noting the client's condition after birth, observing the maternal adaptation process, and assessing maternal emotional readiness to care for the infant, and assessing how comfortable the client appears and providing newborn care. Assess for behaviors that facilitate and indicate parent-newborn bonding. Consider the newborn a family member. Holds the newborn face-to-face, maintaining eye contact. Assigns meaning to the newborn's behavior and views this positively. Responds to the newborn's cries, smiles at, talks to, and sings to the newborn. Assesses for behaviors that impair and indicate a lack of parent-newborn bonding. Apathy when the newborn cries, disgust when the newborn voids, stools, or spits up, expresses disappointment in the newborn, turns away from the newborn, does not seek close physical proximity to the newborn, and does not talk about the newborn's unique features, handles the newborn roughly, and ignores the newborn entirely. Assess for manifestation of mood swings, conflict about maternal role or personal insecurity, feelings of being down, feelings of inadequacy, feelings of anxiety, emotional liability with frequent crying, flat affect and being withdrawn, and feeling unable to care for the newborn. Nursing actions. Facilitate the bonding process by placing the newborn skin to skin or in the in-face position with the client immediately after birth. Promote rooming in as a quiet and private environment that enhances the family bonding process. Promote early initiation of breastfeeding and encourage the client to recognize newborn readiness cues. Teach the client about newborn care to facilitate bonding as the client's confidence improves. Provide frequent praise, support, and reassurance to the client as they move toward independence in caring for the newborn and adjusting to the parental role. Co-parent adaptation. Co-parent adaptation occurs through bonding with the newborn through the following behaviors: using skin-to-skin contact, holding the infant, and engaging in eye-to-eye contact with the newborn. Observing the infant for similarities to the parent's own features. Talking, singing, and reading to the infant. Transition. Research on the transition to fatherhood has revealed the following phases: expectations and intentions, desires to be deeply and emotionally connected with the infant. Confronting reality, understands that reality does not always meet expectations. Commonly expressed emotions include feeling sad, frustrated, and jealous. Can feel like they are unable to talk with the other parent who is consumed with infant caregiving and their own transition to parenthood. Creating the role of the involved co-parent, decides to become actively involved in the care of the newborn. Reaping rewards. Rewards include newborn smiles and the sense of completeness and meaning. Assessment. Nursing assessment of parental adaptation includes observing for the characteristics of newborn bonding. Provide education about infant care with each parent or caregiver and encourage a hands-on approach. Encourage the parents to verbalize concerns and expectations related to newborn care. Sibling adaptation. The addition of a newborn into the family unit affects everyone in the family, including siblings who can experience a temporary separation from parents. Siblings become aware of changes in the parent's behavior because a newborn requires much more of the parent's time. Assessment. Nursing assessment of sibling adaptation to the infant includes the following: assess for positive responses from the sibling, assess for adverse responses from the sibling. This includes indications of sibling rivalry and jealousy, regression in toileting and sleeping habits, aggression towards the newborn. And positive responses are interest and concern of the newborn and increased independence. Nursing actions. Take the sibling on a tour of the obstetric unit. Encourage the parents to do the following: let the sibling be one of the first to see the newborn, provide a gift from the infant to give the sibling, arrange for one parent to spend time with the sibling while the other parent is caring for the newborn, provides preschool-age siblings with a doll to care for. Complications. Emphasize verbal and nonverbal communication skills between the client, caregivers, and the newborn. Provide continued assessment of the client's parenting abilities as well as any other caregivers for the newborn. Provide home visits and group sessions for discussion regarding newborn care and parenting problems. Notify programs that provide prompt and effective community interventions to prevent more serious problems from occurring.